Did you know that 15 to 30% of people with chronic lower back pain actually have issues with their sacroiliac joint, which is also called the SI joint? This often overlooked joint can cause significant discomfort. But the good news is that many people can find relief without surgery. Today, I'm going to share 3 major ways to relieve SI joint pain and get back to living comfortably. Friends, SI joint pain occurs where your spine connects to your pelvis. It may not be as well known as typical lower back pain, but it can just be as uncomfortable. Some symptoms you might notice include a sharp pain on one side of your lower back, often near the buttocks. Pain that travels down into your thighs or groin, especially when standing or sitting for long periods of time. Stiffness or difficulty bending over, twisting, or lifting heavy objects. Sometimes people mistake SI joint pain for sciatica because the pain can radiate down your leg. However, SI joint pain is usually more localized to the hips and lower back. SI joint pain can turn simple tasks into challenges. Walking, sitting for long periods of time, or even getting out of bed can seem really difficult. You might also experience discomfort when you're bending down to tie your shoes or while trying to stand after sitting. But the good news is that SI joint pain doesn't have to control your life. With the right strategies and, of course, muscle activation practices, many people see significant improvements in their pain and mobility. So now let's talk about some of the myths and facts related to SI joint pain. Myth number 1, SI joint pain only happens to older people. Well, here's the fact. SI joint pain can affect people of all ages, not just the elderly. Research indicates that up to 30% of chronic lower back pain cases are attributed to SI joint dysfunction, affecting a wide age range, including younger adults as well as athletes. Myth number 2, SI joint pain and sciatica are the same thing. While both can cause pain in the lower back and legs, they are different conditions. Sciatica involves nerve pain that runs down the leg, while SI joint pain is usually more localized to the lower back and hips. Understanding this is crucial for effective treatment. Myth number 3, rest is the best cure for SI joint pain. And the fact is that while brief rest can help with acute pain, prolonged inactivity actually worsens the symptoms. Movement and gentle activation exercises are key to strengthening the muscles around the joint, preventing further discomfort. Myth number 4, surgery is the only solution for chronic SI joint pain. The fact is that surgery should be the last resort for SI joint pain. The majority of cases improve with non-surgical treatments such as physical therapy, maybe even injections, but more importantly, lifestyle adjustments. According to clinical guidelines, 85% of patients report significant pain relief and improved functionality through conservative methods without needing surgery. So now that you understand what SI joint pain is and how to address some common myths, let's explore how to alleviate your SI joint pain step by step with targeted muscle activation practices. Doing the right movements can help relieve pressure and strengthen the area. So the first one is known as Shalabhasana or locust pose or Superman pose or Superwoman. This pose is fantastic for strengthening your back and activating your glutes. To begin, lie flat on your stomach with your arms alongside your body. Now lift your legs and chest off the ground simultaneously. As you do this, squeeze your glutes tightly and hold for 6 seconds. Now lower back down and repeat this activation 6 times. Remember, The goal is to activate the muscles in your back and glutes while maintaining a steady breath. This not only strengthens those areas, but also improves your overall stability in your body. And remember, 6 seconds, 6 times. Number 2 is our clamshells. Now, this is a fantastic exercise for activating the gluteus medius and piriformis. Start by lying on your side with your knees bent at 90-degree angle, feet stacked on top of each other. Keep your hips stacked as you lift your top knee up while keeping your feet together. Focus on engaging your glutes as you lift up. One big tip, I like to keep my hand on the upper glute to stop it from pressing back. In fact, roll it forward a little bit and keep it there. Hold at the top for 6 seconds before lowering back down and repeat this activation 6 times on each side. This exercise and muscle activation is essential for strengthening and activating the muscles that stabilize your hips and lower back, as well as the SI joint. Now let's activate the iliacus, an essential muscle for the hip flexion, core stability, and also importantly, a pelvic reset. To begin, lie on your back with your legs straightened on the floor. Squeeze your legs together to engage your inner thighs and activate your adductors. Next, lift your legs up about 4 inches off the ground while maintaining that outward toe position. This activation will engage your iliacus and hip flexors. Hold this position for about 6 seconds, feeling the activation in your hips and core. Lower your legs back down and rest for a moment. And remember to repeat this activation 6 times. Remember, activating this muscle is crucial for improving hip function and reducing lower back pain. But here's a pro tip. If you can't lift both legs at the same time, friends, just do one leg at a time. That also works perfectly as well. And finally, our last pose, bridge pose. Now, bridge is an excellent way to activate the glutes while strengthening the lower back muscles. Lie on your back with your knees bent and feet hip distance apart, firmly planted on the ground. Engage and squeeze your glutes as you lift your hips towards the ceiling. Hold this position, 6 seconds, focusing on squeezing those glute muscles tightly. Squeeze them a little bit more. Then lower back down and repeat this activation 6 times. Remember to keep your knees aligned and avoid letting them collapse inward. This pose not only strengthens the lower back, but also enhances hip mobility. These exercises and muscle activations are a great start for relieving SI joint pain. For more in-depth guidance on how to eliminate discomfort and strengthen your body, explore the AYAMA yoga teacher training, yes, by me, Yogi Aaron. You're going to learn how muscle activations can help you to live pain-free. Remember that when managing SI joint pain, keep these important points in mind that can make a big difference in how you feel. The first one is prolonged sitting. Sitting for too long puts extra pressure on your SI joint, increasing discomfort. It's essential to stand up and move around more regularly. Consider high-impact activities. If you enjoy running or jumping, be aware that these activities can worsen your pain by straining your joints. Perhaps focus on lower impact options such as swimming or walking. And if you are going to do them, make sure you do your muscle activations first. The next one is poor posture. Slouching or sitting with bad posture just doesn't affect your spine. It also adds strain on your SI joint. Ensure that you're maintaining good posture while sitting or standing. Next is improper lifting techniques. Always lift with your knees, not your back. Bending at the waist while lifting heavy objects can put unnecessary stress on your SI joint. These small adjustments in your daily habits can help reduce strain on your SI joint and potentially prevent flare-ups. Friends, SI joint pain can be frustrating, but with the right approach, you can manage it effectively. Remember that taking small steps every day can lead to significant improvements. If you found these tips helpful, please share your thoughts in the comment section below because I love to hear from you and know how these muscle activations are helping you. If you're ready to take control of your pain, please visit yogiaaron.com and sign up for our free, yes, I said free, series to discover how to live pain-free and unlock your body's potential. Don't wait. Start your pain-free journey today.